are saying, you know, they missed the deadline. They should not be allowed to. I get that. I understand, but I'm also getting people who are saying you need to help the other end.
Health Services Committee meeting on this Monday morning, October the 24th to order. First thing on the agenda is to approve of the minutes from last month's meeting. Would someone like to make that motion? Supervisor Durante, seconded by Supervisor Hanover. Any additions or corrections to the minutes? If not, we'll vote on it. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. We're going to start with Office of Community Services Mental Health. Rob cannot be here today, but I assured him that we could take care of a couple of items that we found on his agenda. So we're going to just move forward with that. And we're going to start with request number 1. A request to fill a vacant position, Deputy Director Clinical, due to retirement. Lisa Coutu, how do you say that? Coutu? Okay, thank you. Deputy Director Clinical has provided notice of her planned retirement effective 1/2/2023. Request to backfill the position due to the retirement. So someone would like to make a motion to accept that request. Supervisor Conover, second by Supervisor McDevitt. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. And the second request is to fill a vacant position, Children and Youth SPOA Coordinator. The rationale is a request to backfill the position due to promotional opportunity. So I would like to make that motion to fill that vacant position. Supervisor Conover, second by Supervisor Girardi. Any discussion? All right, then we'll vote. All those in favor?
Aye.
Opposed? Carried. And Rob did say that he was going to discuss the youth behavioral health services issues, but we will discuss that next one when he's back here to discuss it with us in person. So with that, that's it. Yes.
Yeah, if you could, for next month's meeting, a lot of us voted for funding for NACO based on the strength of Rob's recommendation. If we could get a report from him relative to what he envisions happening with that 65,000, just something brief.
Okay.
Simply because he didn't have a chance, we didn't have a chance to hear from him in committee.
No, you're right.
You know, like I said, I think a lot of supervisors voted for that based on his recommendation.
Because he had, I agree with you that he recommended.
Anything brief, that
Okay.
committee would be good.
I'll do that, Mr. Conover. All right, with that, then we're going to move right into Office of the Aging. Good morning, Dee.
Good morning. So the first item on our agenda is permission to enter into a memorandum of understanding with North Country Healthy Heart Network to be a part of the North Country Chronic Disease Prevention Coalition.
All right, would you just explain that rationale, please, Dee?
So this is a coalition that identifies gaps and then it plans, develops, and supports the implementation of chronic disease prevention and self-management programs and activities in the area. There's no monetary obligation of this, but basically it tries to assist with minimizing the chronic diseases such as diabetes, cardiopulmonary diseases, things like that.
Okay, thank you. Would someone like to bring that motion to the floor? Supervisor Conover, seconded by Supervisor Girardi. Any discussion on that? Now we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
Item number 2 is permission to increase our Title III contract with the Greater Adirondack Home Aids from $35,000 to $55,000 for this program year only. We do have carryover funding from 2021, which will help us do this. And it is needed for this year because we have had increased needs for aid services for seniors in Warren County.
Supervisor Conover makes a motion, seconded by Supervisor McDevitt. Any discussion? Right, now we'll vote on that. All those in favor? Aye. Opposed? Carried. Thank you. Number 3, Dee.
This is permission to amend resolution 439 of 2017. This is the resolution for our lease contracts for the meal sites. And basically it's to amend the language to increase the following language, which is funds to carry or to cover any of the county's maintenance, repair, or other obligations under the respective lease agreements be paid as necessary from the appropriate budget codes. And this is necessary so that we have permission to reimburse or pay for certain expenses associated with the operation of the meal site, such as electricity, propane, things of that nature.
Supervisor Conover makes that motion, a second to that motion. Supervisor Geraci, any discussion? Supervisor?
Is there, thank you so much, Chairwoman. Is there a financial implication to this language?
No.
Or are we already paying for all of these?
We have already been doing it. It just wasn't specified. And that when it came up for renewal, because we do a 5-year lease contracts, the county attorney's office recommended that we include this language so that we actually have authorization to reimburse them, even though we've already been doing it.
Go ahead.
Some of these on the second sheet,
Mhm.
are they? I thought some of these, I'm sorry, I don't know specifically which ones are not operating. Are we paying for rent even though we're not operating meal sites?
So the First Presbyterian Church, we're not currently paying that rent because we're not at that location. And if there's a location that we're not currently at, which that is the only one in here, we haven't been paying it, no.
Any other questions? All right, then let's vote on it. Yes, go ahead.
Do you want to explain? Most of these are for $1, but others have significant amounts.
Yes. So, the town of Wells, see, most of the Hamilton County ones, we don't actually reimburse most of the expenses, which is the town of Wells, town of Long Lake, or town of Indian Lake. The Lake Pleasant Senior Citizens Group, we do reimburse for snow removal, electricity, and heat. We do, I believe it's 85% of those. Town of Lake Luzerne, we do 13,000 each year. Town of Johnsburg, we typically reimburse a percentage of the electricity. Town of Chester, we pay the propane. First Presbyterian Church, we were typically just doing the $3,000 a year, but currently we're not there, so we haven't been paying it. Countryside, we reimburse a per meal figure. And then for the Church of Saint Sacrament in Bolton Landing, we reimburse for electricity and heat. And then we do the snow removal and the trash removal, but then the town of Bolton actually reimburses us for that.
Thank you. All right, any other discussion? Let's vote on that. All in favor? Aye. Opposed? Carried. All right, let's go down to the discussion items, which we started with last month, the WC 48-22 Warren Hamilton County's Office for the Aging Senior Nutrition Meal Program Supplemental RFP. Well, we made sure after last month's meeting that everybody got a copy of it. So I'm assuming that with the month, everyone took some time to read over that RFP, and I would like a little bit of discussion. We need a little bit, Dee, I guess I'm going to ask you to give us just a little bit of background, a little bit of discussion, and then I'd like to hear what the board members have to say.
So I believe that the new RFP stemmed out of discussions out of the ARPA meeting, where the Salvation Army was asked to put in a proposal to basically look at the Cedars taking over the Glens Falls, Queensbury meal preparation and delivery for that area, because we were having difficulty coming up with enough volunteers to.
Cedars or Salvation Army? You said
Sorry, Salvation Army
Oh, okay.
put in the proposal, sorry. Because we were having difficulty coming up with enough volunteers to deliver the meals 5 days a week. And then also because we are having difficulty finding enough drivers to deliver to the Lake George route, which is still getting the mom's meals instead of our meals. So the RFP went out and Salvation Army was the only one that put in a bid, and that's the one that was included and sent out to all of the supervisors. So they put in the proposal to provide meals. The details are in there, but it was $9.72 a meal if we needed more than 60,000 meals a year, or $8.56 a meal if it was, $9.72 a meal if it was under 60,000 meals a year, or $8.56 a meal if it was between 60,000 and 100,000 meals. And then if they delivered the meals, it was $2.50 a mile. If it wasn't done through volunteers. So if they had staffing that had to deliver the meals, otherwise it would stay as it currently was, where we reimburse the drivers, the mileage.
All right, like I say, we've all had a month to look over that RFP, and I guess I'd like to hear your comments. I'd like to hear why you don't think it's a good idea or why you think it is a good idea. And as Dee told us at the end of last month, it doesn't make any difference to her one way or another. But this is what they offered us, and I'm just looking at it as far as the seniors themselves. We did hear that they could take part in activities. If they went there for meals, they could take part in the activities that take place there. That to me certainly sounds like a plus. It gives them an opportunity to be involved in some other things that they wouldn't be in other than just getting their meal. So Ron, what have you got to say?
Well, I think the last time this came up, I was thinking of this in really two parts. Do we need to really think about consolidating our meal production under contract in one spot? And because really at Cedars, they have the meal production that they do there, and then of course they have the service that they do there. There's a lot of seniors there, so I mean, it's a good spot because there's a lot of seniors there. You certainly don't need them to have to pick up and go somewhere else to get those service. So it seems to me that the question becomes, do we need to consolidate our meal production and why? And then there's the quantitative side, the money side, but then there's the qualitative side, right? So I mean, it's both really. I mean, that we need to be thinking about here. Maybe at some point, maybe Dee could talk about the challenges going forward of our continuing to attempt to produce the meals with our own staff through our existing systems as opposed to contracting it. Maybe that both quantitatively in terms of money, but also qualitatively.
Dee, my question was, I was under the impression at Cedars, they would still be producing the meals for the people who were there. What, am I incorrect on that? I thought the Salvation Army was dealing with like Glens Falls, Queensberry ones that no longer had a site to go to.
Well, the Salvation Army would take over the entire production for the Queensberry Glens Falls area, including Cedars.
Okay,
So they would make the meals and then we would deliver them to the Cedars people that are getting the meals.
okay,
Now the Cedars location themselves, they have a kitchen still. A lot of the kitchen or the equipment in the kitchen is theirs. So they could still have a provider come in and make meals. One big difference between the two is that the Cedars location is only open to Cedars residents, whereas the Salvation Army would be open to everybody in the area. So anybody could come in to get the meals there at the congregate setting, the dine-in location. But at Cedars, it's only open to their clients, their residents.
all right, thank you.
No, I have a question, I think, and I think I asked it maybe at our last meeting. Do you know if the Salvation Army has gone before the Common Council in the city of Glens Falls and explained their proposal and gotten appropriate approvals and to go ahead with it?
Well, they already have a kitchen where they are.
Okay.
They're already doing this, so I don't think that they would need approval. But in the RFP, they have a letter from the mayor, so I believe that they have spoken with the city of Glens Falls, but I can't say specifically.
Yeah. And Ron used a very important word, and that's the qualitative side of it in terms of the comfort level. Do you have a comfort level with the Salvation Army as far as preparing a quality meal for senior citizens?
We would be monitoring it. So I believe that there would be a good quality. I don't think that Major Leo is going to produce something that wouldn't be good. And he provides meals currently right now to a number of individuals in the area. So I'm sure it would be a good quality. And then to answer Supervisor Conover's question about the production and having a consolidated kitchen. I think that's a great idea to have one kitchen instead of all the various ones we have. And I think that would make it easier for us to get the products and the supplies that we need. In 2020 and 2021, we had the issues of getting food supplies. So I think it would be much easier if we had just one or two kitchens as opposed to 10. So that is a plus of it. And then they would be able to expand. They also talked about doing, having the meals and then bringing them to different locations, different churches, different senior homes, different things like that, and having just like a small, congregate meal for those individuals. So, having more for the program than what we can offer right now.
Just a minute, Supervisor Geraci.
Yeah, just a question on the delivery fees. It seems to be a little excessive, not knowing the whole perspective of it, but if I'm correct, you said 250 per mile or 250
Per mile, and that's if they have to have their staff deliver it, if they can't find a volunteer to deliver it, and that's only for the Lake George route. That's not for the Glens Falls and the Queensbury people. That we already have the volunteer base to do most of it, and then they have some volunteers as well that they could incorporate. This is only for the Lake George area.
Okay, so the cost of the delivery could be more than the meal though, essentially. I don't know what the distance might be, but if they had to travel 10 miles round trip or 10 miles, that's a $50
Right.
delivery fee.
Right, but I think they have a very good volunteer base. I don't think that would come into play. I don't think that would be an issue,
Okay, thank you.
honestly, but it is
Supervisor
something.
Conover. I'll get to you in just a minute.
I think what I'm getting at is, these are our constituents, and they're getting a service, that they're generally happy with. And now we're gonna make a change, or is the possibility of a change. And so we are making the change because we're gonna save $500,000 a year. We're making the change because, well, we're not gonna save a lot of money, maybe $30,000 a year. But we are unable to continue to manufacture the meals. Now, that's an answer, right? That we're getting to the point where we're unable to do that. And I guess what I'm trying to see is, okay, we have a proposal. All of the proposals are interesting. We should always be looking at proposals, but the question is, okay, we're gonna take something that's working reasonably well. We're gonna discontinue continue the production. For what reason? In other words, so for example, let's say that it costs $5 to produce a unit price at one location. And we're going to just continue that, and it's going to cost us $3 at another location. Well, that's a savings of $2, and that equals the following. Something tells me that it isn't singularly monetary, because I don't know that the dollars really become huge. There's something else moving this, and I suspect it's that the staff is worried that their ability to continue to deliver staff and production ability at this location. If that's the case, then I think that's something we need to delve into before we make a change like this. Before we have a room full of people upset, let's have ourselves understand this to the point where, we can explain whether they like or don't like what we can explain ourselves. I mean, that's where I'm at with this, and because maybe we're having difficulty in parts of the system, but we're not having difficulty at this part of the system. So maybe we don't want to sweep this into the other parts where we have problems. I don't know.
Supervisor Driscoll.
Thank you, Chairwoman. At 10:15, about 10 minutes ago, I got a phone call from Major Lloyd, and he had just got back from vacation and wanted to know if his proposal was being discussed. And I said, well, coincidentally enough, it's being discussed as we speak. So he just wanted me to share with the committee that he's always available and interested in speaking with committee members, county administration, and all any supervisors on a one-on-one basis or as a group to answer questions and discuss concerns or what we might want to talk to him about. So he's available, and whether it's another meeting or we're neighbors on Broad Street in Glens Falls, so not too far away. He's always interested in again engaging the committee.
All right, let him know how much we appreciate him making that offer.
Sure.
But just a minute, Mr. McGowan. Dee, I was under the impression that this wasn't to involve the whole county at this point, was it? I
No.
thought he was looking at dealing with Glens Falls and Queensbury because they have a problem with basically no place that they could, let's say, go meet and sit down and have lunch, right? I mean, I didn't think when we started this, we talked about those two areas, and maybe later on down the road someplace, you might say, hey, it would work better. Maybe you should do this and this and this. But at this point, what we're looking at is the Glens Falls and Queensbury people. Is that correct?
Correct. And then that one Lake George route.
Right, and that one Lake George route. I just want to make sure we're all on the same page, because I know I get the impression from Ron that we're looking at the entire county with
No.
the meals, and we are not looking at the entire county with it. We're just looking at Glens Falls and Queensbury because they're in a position where it would be nice for them to be able to go someplace, sit down, have lunch, and socialize with some other people that are there. Go ahead, Mr. Conover.
Yeah, no, I understand that part of it. I guess what I'm saying is, I suppose we could contract Glens Falls and the Lake George route, and we could leave Queensbury exactly the way it is, and maybe we could consolidate what limited resources we have at Cedars, right? In other words, that maybe it would allow us to transfer people that we have to the Cedars situation. Why, as an option? Now, if that's not a viable option, I think that why isn't it a viable option? It may not be as some people may not consider it as preferred, but you leave Cedars the way it is, and then you contract the rest of it, and let's see where we are 12 months or 24 months down the road. Well, is that an option? I guess I would put that on.
What specifically are you looking to contract?
Continue to contact meal for us to continue production at Cedars.
And not do this at all?
Do that.
Okay.
Do that as well. Do that for Glens Falls. Do that because that's a service and the production. That's something that's needed in Glens Falls, but maybe maintain Cedars Cedars operations the way it is presently.
We wouldn't need both.
Well, now that's what I'm saying to you is that I don't know. You might get a different answer from different people in terms of answering that question. Do we need both? I suppose if you want to be, a certain way, no, but on another way, maybe there's no harm in continuing both. If we can deliver at Cedars and we feel we can deliver at Cedars, we'll continue that for now, and maybe we gravitate in some fashion later if it's needed. I'm just trying to understand. I'm all for consolidation. I'm all for saving money. At the same time, I'm concerned that, there's certain aspects of what's going on at Cedars that is social, that's qualitative, it's very nice. And I'm sure for the people that reside there, it's a wonderful thing. And so and all we would be doing is producing the meals, but maybe we don't need to do that in the initial stages here. That's what I'm wondering.
I'll go back to, I'm sorry. Brad, you had your hand up quite a while ago.
Well, that's all right. Let's finish up with the committee. I'll
All right,
wait.
Supervisor Bramer.
Thank you, Chairwoman. I'm with my colleague from Bolton that I don't understand yet. I'm not fully understanding why we would make the change that is being proposed. if we have Cedars is producing the meals for Glens Falls and Queensberry. And Salvation Army's proposal, I'm looking at it, thank you for getting it emailed out, it says it would consolidate 3 sites that are currently closed, Cedars, First Presbyterian and Solomon. What I understand Cedars is open now.
No,
No, they're not open. So, and then for the Lake George route, it says they would deliver meals Monday, Wednesdays, and Fridays. So even they're not doing 5 days a week. I guess I just don't understand, if we go to just Glens Falls, from my perspective, First Pres is in my ward. Why wouldn't we just open up First Pres with the meals that are already being made? If we want to congregate site in Glens Falls, which I think is great, I think we should.
we don't have staffing.
So that's the bigger issue, is that we do not have staffing.
We
in
do
the
not have
office.
staffing. We do not have volunteers to deliver the meals. We don't have staffing to open up the congregate sites, and we don't have volunteers to deliver meals 5 days a week.
And is it your assessment that all of that came from COVID? The
Yes.
COVID timeframe, like where
The
we lost
volunteers.
our
Yeah.
volunteers. And so the idea is we need outside Salvation Army to help manage volunteers because they have a better
Right.
volunteer system.
Well, even before COVID, we were starting to have issues with our volunteer drivers. We were having to pick up and do routes at least once a day. And sometimes 2 routes a day, to pick up the slack because we didn't have a good volunteer base. We were having difficulty. But because of COVID, we went down to the 3 days a week to minimize contact with the seniors and potential exposure. But since COVID, we have not been able to build the volunteer base back up at all.
Pretty good, so I can call him Brad.
Well, I would remind you, Chairwoman, that non-committee members are not supposed to be talking.
Oh, pardon me. but
Regulars.
sometimes-
I know, I know.
You've reminded me, this is what the route I guess we should take. Could we ask for the gentleman from the Salvation Army to be present at next month's meeting? So I don't know, seems like we're making a very big production out of it, but go ahead.
Just to bring us right up into the present point here. This was an RFP that went out months ago. We've been sitting on this RFP for, and Dee, correct me here, 3 months. And a decision should be made to honor all of the good intent of the folks that had responded to the RFP. So I'm sure a decision would be appreciated by the Salvation Army on these things. If there is more information that needs to be gathered in order for the committee to make that, I'm sure we can pull that together. But for clarification on this, the Warren County Office for the Aging staffs the Cedars Kitchen and provides meals for residents of Cedars, which is not open to the public. Is that correct?
Correct.
And we also produce meals to go from that location as well that get delivered throughout the Queensbury community. That's correct.
Queensberry and Glens Falls.
And Glens Falls as well. So what would switch on this if the committee had decides to take up the RFP from the Salvation Army is the Cedars facility would get meals delivered to their site. Is that correct?
Anyone that's getting home delivered meals at Cedars would continue to get home delivered meals.
And so they would not have a congregate setting there?
We could if you guys wanted to, yes. I mean,
Separate and apart from the contract with.
yes,
And also on this contract with the Salvation Army, is it correct that there was more of a social side on this of integrating folks into the workforce, training and all of that? And they're responsible for all that human resources part of it. The county is not.
correct.
So
Yeah.
your suggestion is that we should act on this today? Is that what you're
If-
saying?
If the committee needs to be comfortable with the information that they have on hand, like you say, the RFP's been available for review here for over the past month or so. So there's, I would always encourage, efficiency in government is always a tough one to get. And if we can come up with a decision sooner than later that adds to the efficiency in government, doesn't hold up folks on the private side or nonprofit side to be able to plan out for their 2023 year, what's coming up. As well as us to be able to budget.
So my question is, does the committee feel that you have enough information from that RFP, or you're not happy with the amount of information that you have at this point? Peter?
Yeah, I don't live very far from where this location is. I'd like to go myself personally, take me all of 5 minutes to get there, okay? And let me actually look at the facility and get and feel comfortable with. Let me talk to the major and just kind of look at the facility and feel comfortable that this is a good solution. I suspect it is, and just so that I better understand and feel comfortable with it. So
I think that's a wonderful idea.
Yep.
Maybe some other committee member might wish to do the same. You might walk away with a different idea than what you have. So I guess I'm looking at it this way. We really can't act on it until next month because Peter would like the opportunity to go check it out. So can I get the idea that that's how the committee feels? Can we put it off until next month? We'll listen to what Peter has to say. Maybe in the meantime, maybe Claudia lives down in that area. She
Sure.
might want to go check it out too, to just
Yep.
see what they have to offer. It's easy to be critical of something, but if you actually go see how it operates, then you might say, hey, this is not what I thought it was going to be. Mr. Conover.
Yeah, I just want to get a sense, Steve, from you, how critical you think the staffing situation is in the production. I mean, are we actually going to fail in the production of the meals?
We haven't been now. As far as the production of the meals go, no. As far as reopening the congregate sites, until we get the staff in place, we're not going to be able to do that. And as far as delivering meals 5 days a week, until we get the volunteer base, we're not going to be able to do that. And it's been at least a year that we have been working on that. As far as the staffing goes, even with the increase in the salary, we are still having difficulty. And that's across the board in all departments, in all agencies, in everywhere across New York State and other states as well. So I don't know.
To follow on it, that's why I think I'm wondering whether there's a gradual approach here that where the Salvation Army takes over certain responsibilities, but not all responsibilities. Now, will there be additional cost to that? Well, yes, but how much are we talking about here? And I think I would like to know that. If we're talking hundreds of thousands of dollars, well, that's one thing, but if we're talking a few $1,000s, then that's really something else entirely. I mean, it's before I turn something on upside down, some people are going to view as upside down. I want to make sure that, we have good justification before we do it, having been through this a number of times in a number of different locations. So I don't ever want the senior citizens to think that we're not looking out for their best interests in terms of our decision making. In other words, or any group for that matter.
Mhm.
I mean, I think that it's a very significant thing. I mean, it's like I say, it's not just the meals, it's just a social setting, it's a congregate site, there's a certain thing going on there. I mean, I suppose we could contract with anyone to produce the meals out of Cedars, couldn't we? I mean, if the issue is where are the meals produced, they could be produced out of, well, they are being produced out of, so we could contract the Cedars site, right? We don't have to move the program lock, stock and barrel. I don't know. I'm just like broaching like different ways of looking at this thing that I think we should do our due diligence before when we make a decision. I think we should communicate it well as well. Whatever we're going to do, I think we should try to communicate it well. Why we're doing it. You might find there might be general support. On the other hand, there may not be, but I think there are going to be some very specific questions. Why are you doing this? And if it's we can't staff the facility, or we're worrying about failing in our production of facilities, which we could never, ever, ever do, then the question is, well, then we're gonna need to contract it privately. Well, okay, well, contract it privately if that's what you need to do, but don't. But this is more than that. We're talking about moving this to another location and just keeping it with home delivery or as a congregate site. And I'm not sure I'm not comfortable with that just yet. I know you want a decision, I know people want a decision, but
I think, Ron, what we're gonna do is put it on the agenda next month for an action item. If that meets with your approval, Peter can check it out. We can ask the gentleman from Salvation Army to be here, so if we have further questions, and we have to sooner or later just act on it and get it taken care of. Dee?
Just to clarify, as far as this contract, what it would be is actually just kind of picking up everything just as it is at Cedars and just moving it to Salvation. I'm sorry, it would be basically the same staff, the same volunteers. Everything would be exactly the same. It's just we would be paying Salvation Army, same menus, almost the same vendors too. It would just be, we would be paying Salvation Army instead of paying all of everything ourselves. But I would be happy if you guys can get me your questions, trying to get those answers before the next committee meeting. And even if it's questions as far as, could they do something else instead of the whole thing? Trying to get those answers so that when we come back to committee next month, we could make a decision, whether to do it or not to do it.
That's a very good idea, Dee.
What's that?
But
It's
the committee members to make a point of getting in touch with Dee. Don't wait until next month and all of a sudden you have 14 questions for her, which you could have dealt with during the month if you just picked up the phone and gave her a call. So I'm gonna lay that responsibility on committee members, that you need to kind of deal with this issue. You can't just keep putting it off and putting it off. So that's how we're gonna leave it. Then at this point, we'll put it on the agenda for next month as an action item. All right, with that, guess I don't have anything else. Dee, do you have anything else?
Just one other thing for everybody to know, it is open enrollment for health insurance. So we have a lot of seniors calling us to help walk them through the process. So if you know of any seniors 60 and over that needs help with their health insurance, what Part D program to select, what other insurance program, have them give us a call so we can schedule an appointment, encourage them not to just walk in because it usually takes at least an hour. So have them give us a call ahead of time so we let them know what to bring in and we make sure we have somebody available for them. But open enrollment is in place until I believe it's December 5th. And then the heat season is opening up fairly soon, I believe it as well. That's the Home Energy Assistance Program. So we help with those applications as well. So I just wanted to make sure everybody knew that so that our seniors can be assisted as much as we can help them.
Great, we appreciate that. Thank you very much, Dee. Supervisor Bramer.
I will take up your suggestion to contact Dee in between, but I do want to ask on the record at this committee meeting about the staff. If we are going to have Salvation Army take over this, what is happening with our staff?
You just said.
Are
They
we
were
paying
going
them to work in Salvation Army? And if we are not, then how are we going to tell people you're now going to lose your county job and you're going to go work for a not-for-profit? We have no control over their salary, benefits, retirement, any of that. I think that's a significant thing that you just said, that their staff will be paid for by Salvation Army. Is that true?
That was the intent, yeah, is that the Salvation Army, they're going to offer our staff positions and that they will be paying them. Yes.
So I'd like to know, I will ask you offline, what the savings that we'll see from losing the income costs of those people.
We're not looking at any savings or anything from that, and you'd have to speak with Major Lloyd to find out what the salaries would be.
We would
Or
be
health
losing,
insurance.
and we would be losing the costs of those employees. That's a savings to the county.
What do you mean we would be losing the cost of those employees?
The employees that would no longer work for the county, we would no longer have those as costs. I'd
But
like
that
to
would be
know-
factored into the contract.
Okay, I'd
So
like to
we-
know what that analysis is. The savings and not having a income cost anymore versus we'll be now paying $9.72 per meal to Salvation Army.
Supervisor Conover, then we're gonna wrap it up.
Yeah, I mean, first thing, let's remember, it's not Dee's proposal.
Right, exactly.
She didn't advance this as her proposal. This was advanced by the Salvation Army. And I think that it has some very interesting features, particularly in areas where we're weak or where we're failing. So as it relates to Lake George and Glens Falls. And so, you know, it just seems to me that that really the question for me right now seems to boil down to, you know, we're not doing it for monetary reasons. Okay, it's not doing it for money. We're doing it to try to provide continuing better service, more diversified service to Glens Falls in particular, and Lake George and possibly Queensberry in terms of some of the programming that's going on. So we're not doing it for monetary reasons. So we're doing it because it would seem to me, because we're beginning to question our ability to be able to do this on a long-term basis. And so, you know, it hasn't gotten this part hasn't gotten super critical yet, but we know we've had issues. Staffing, we know staff retention, we know we've got challenges associated with this. And so the explanation is, well, if we did this, it would be, I would think it would be because organizationally, we just don't think we can continue to do this anymore. If we can continue to do this for the foreseeable future, then it seems to me the question becomes, you know, well, how do we do this without throwing the baby out with the bathwater, right? In other words, because it's not a monetary thing. We're not doing it for monetary reasons. What we pay our employees, we're going to take some part of that. We're going to pay the Salvation Army, right? So it's I can't believe that the differential is, you know, that significant. So I think that's kind of where I come down on this right now, is in my mind, I've got a big question mark as to, you know, and maybe if we got to a point where we felt that this needed to happen, then I think that we should meet with those people most immediately affected. I think that's incumbent on us to do that and to explain where we are and what's going on, and begin a process whereby people understand, you know, what's happening and what we're doing, as opposed to just some administrative kind of
Right, I hear you.
disconnected kind of decision. You know, that's what I'm concerned about. I don't want this board, I don't want this committee, I don't want our staff put in a position where it appears as if we're being insensitive, or that we don't care. We do care. We do care. And I think we should labor with this as long as it takes us to labor with it. And I think, because I think that it's that important.
All right, Supervisor Droche, and then I'm gonna wrap it up.
Okay, it's very, very quick. I think Supervisor Bramer brings up a very valid point in terms of county employees. So for the next meeting, I would ask, could we get an analysis of how many employees are we talking about? What's their current salary and benefits, and what would be their proposed salary and benefits? I think that's part of the equation that we don't have right now.
Can we do that, Dee? Oh, we'd have to do that.
That would be up to Major Lloyd.
Right, I was just gonna say, yes. You could be the one who tells how many and what they're getting now.
Yes.
He has to come in with what would be the salary if they go with him.
Mhm.
Right, okay, thank you. All right, with that, then I think we are gonna wrap it up. We are kind of running behind. We have to do health services next, so that's what's on our agenda for next month. Thank you. Brad, I'm told I'm not supposed to call on you.
Right, and now, because now we're into the privilege of.
I was gonna
the
give
board,
you a call back, but
Which I think BS,
Unfortunately,
I need to talk a while ago.
distribute
Well, let's see. So now it's your turn.
Thanksgiving baskets, but I know we'll welcome.
Go ahead.
I'll just speak.
All right.
Well, this is nice.
You tell me it's time.
Hey, we have been dealing with this for quite a long time. I remember starting when I first came on board as a supervisor. And, you know, at the Cedars, and we've had some problems. Now, the Salvation Army is a phenomenal organization, and I will be reaching out to Sergeant, the Major myself. And would be more than happy to you know, join you, Peter, and sorry.
In defense of
my fellow, members of Glens Falls, at the,
We would appreciate
to
it.
go over with the major.
Thank you.
You know, we have a major problem here, and there's a lot of dynamics that have tied into this, along with not being able to get the help in the food. And, but, you know, as it said, we do have to look out for the employees that we have, and even though we aren't doing this as a monetary value, but what we have to look at it as a more efficient value. And, was impressed with the RFP from the major. And I think there's some things that, you know, we can balance out, but I would really like to stay on this. This has been going on a long problem, hasn't it? I've been involved with it. I've seen it. And, you know, it's just always been one problem after another. We get one fixed. We do have coolers now that are electrified, battery backup. So, you know, we could keep the congregate sites open. I mean, these meals can come in and they can be put out, you know, for the people, so they can come in, so we could keep, you know, the sites, but what we'd have to do is we could have a smaller staff that deliver them. I mean, those are some of the smaller things we can, so you can get that socialization. There's a, you know, a few things that can work out here, but you know, it's really, I do believe it's something that we have to stay on top of, and hopefully we can have a decision by next month. I wanted to say a little bit more, but I feel the pressure is on me, so thank you.
Thank you, but I appreciate your comments, Brad, and I appreciate your interest in the problem. All right, with that, then I'm going to say that this group, we're finished and we're going to move on to health services. Enjoy the rest of the day. And that's where we're at.
What would you look forward?
We'll have to move fast. I'm glad you're going, Peter. I appreciate it.
No, but the employee issue that all of a sudden, I hadn't even thought of that. Hey, that,
Maybe
But maybe someone will be pleased to go.
if we're not producing for the entire region there, but we're just producing for the congregate site, like a lot of the sites used to do, you need as much staff. I'm wondering, in other words, right now, that's the production facility was for a bigger area. This, if they're not producing for the big area, why can't they just produce for the congregate site?
Why don't we just ask them to help open up a site in Glens Falls? If that's the issue,
I'm gonna get.
why are we scrapping?
They haven't had help, is was my understanding.
I would be careful with the message we send here as well. Let's be careful here. I'm gonna want to hear from the Glens Falls and Queensbury representatives specifically on this. They're the ones most immediately affected. You get all the rank from Queensbury. Oh, we should do this. I'm with you. I'm saying,
They're talking about making the meals for the rest of the county. It's not just Glens Falls, Queensbury, Lake George.
We are still on the,
I'm
Whatever.
confused as to what.
you
Yes,
might only need half the people if you're only producing for the congregate side. I don't know. I don't know if that's feasible. That's one of the things, it's not an option that's been discussed. See my point?
lot of other things. Did you find them?
That's Sam or Sarah's calling. Okay, I'll text. For some reason.
They are out there.
Yeah. You know what happened, we were gonna send it over to the inmate.
Sorry.
Okay,
I've got the other meeting coming up. I think you still have a this one.
if not, we'll ask Kevin.
Have you heard anything from people about this?
I have not, okay. I
I know that, like, First Press is willing to open their kitchen and their, what's it called? Dining room are available.
I haven't felt a need from anyone saying, we want a congregate center, we want a place to go and kind of eat and kibitz. They just want their meals delivered.
Yeah.
And, you know, healthy, high quality meal delivered.
Yeah,
Uh,
maybe since COVID, people don't care about meeting in a congregate site.
I don't know. I guess I just don't know. It, just kind of what have they been used to over the years? Okay, and I think what they've been used to is getting a meal delivered. So, and I don't. I don't know.
Good question.
Where's this stuff?
Hey, Peter, let's try to go over at once so we can have lunch there, right?
We'll do it, you know, within the. The facility, see if he's set up to,
North,
you know.
but let's focus on.
The
office is down in Broad Street.
Yeah, yeah.
They no longer.
The old church.
Yeah.
No.
Just order.
Just used to rent that place also, yeah.
How is he?
Queensbury.
But, they obviously must have a kitchen in there and.
Maybe that's not a bad thing to do. Also keep the production there.
They manage.
Yeah.
I envy.
Yeah.
Dollars that they.
You know, his
Also,
proposal at one time was to up the piece.
I know.
A piece of property that Shabbat owns.
Otherwise, would be the answer to be.
Yeah, that's the thing, yeah. All day Monday and then until like 1 o'clock.
And you know what? And we need to hear from the Queensbury people on this.
No, he'll be here. He'll be here. He's got a good, take a half hour away from the
Purchase Right aid.
Okay.
And that for. I feel immigration to me. Yeah.
It was a huge investment.
Yeah, yeah. What was it? That piece of property is $1 million. That's about the asking price.
Northway Exchange, are they gone? Northway Communication.
Yeah, he's Mike is, he moved his operations into his late parents on State Street. But yeah, he's, yeah. Yeah. He lost his, over a year ago. Yeah. She was a nurse at the Clinton House.
You might think it's bad.
Yeah.
See how.
Yeah, he's loose on Stewart Avenue and let's focus.
Good guy.
But it's, yeah, his first parents have a place right up the street. But he does it good.
That's not gonna be an easy meeting.
People losing jobs. That's not, how could that be not an easy meeting? County job. I think that sounds good to me.
Electrical service going on. Today.
We all set? Good morning.
I think.
Good morning, everybody. Happy Monday to you. My first resolution request is to authorize an agreement with my Nexus commercial insurance carrier so that health services can bill for services rendered to the company's members, and authorizing automatic annual renewal unless there's 30-day written termination notice provided by either party. This is a commercial insurance company, of which some of our home care patients may have. And if we provide services to our home care patients, we're looking for that payment from this insurance company.
All right, someone like to bring the motion to the floor. Supervisor Conover, seconded by Supervisor McDevitt. Any questions? All right, we'll vote on it. Oh, excuse me, go ahead.
Dollar amount.
Dollar amount, Janelle?
There's not, because it's variable on the different types of services rendered and the client's coverage plan.
That's all in the contract.
This contract is going to be similar to the Care Centrics agreement that we recently are still negotiating, but you passed last month. It's going to be for services that we provide billed based on the type of service, based on the state code, I believe, correct?
Any other questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The second resolution request is to authorize an amendment to NetSmart Technologies and Company, AKA McBee. It's a contract to reflect an increased rate for coding services. The rate increase is going to go from $65 a chart to $75 a chart. We're also looking for authorization for annual renewals as long as the annual rate does not increase or exceed past 5%, or either party does a written termination. Health Services utilizes this vendor for coding and chart review to ensure our compliance with regulations and optimization of eligible revenue. We have an average of 50 chart reviews a month, so we anticipate the costs to increase $6,000 a year. With that increase, the annual cost is still less than hiring an individual to do the work.
Bring that motion to the floor. Supervisor Conover, seconded by Supervisor McDevitt. Any discussion? Any questions? Go ahead. Yes.
Thank you, Madam Chairwoman. And this was triggered because resolution number 479 in 2019 had the 5% in it, and this exceeds 5%. Thank you.
All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Number 3.
My third resolution request is to award WC 5422 point of care software system for public health to Home Care Home Base in the amount of $122,500 with a monthly fee of $2,925. Health Services will use our district funding to cover the anticipated expenses. This is for our electronic medical record vendor.
Bring that motion to the floor. Supervisor Conover, seconded by Supervisor Devitt. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
For resolution number 4, we have a request to transfer funds for our 2022 budget, and that's attachment 9, and I will defer to Tom.
Basically what I'm doing is moving $2,000 to get it through the end of the year out of full-time salary to part-time salary for one of our employees. It's primarily because of our Children with Special Health Care Needs grant. We just don't have enough right now in the budget to cover that. It's like 179 is left in there. We just have to get enough to get to the end of the year. Our new grant with that just started October 1st. I don't need to move any benefits because they're already there. And the full-time's the same, so we just have to move salary.
I'm gonna bring that to the floor. Supervisor Conover, seconded by Supervisor McDevitt. Any discussion? Okay, all those in favor? Aye. Opposed? Carried. Thank you.
All right, under discussion items, Val Wisnot attended our Home Care Association's Emergency Preparedness Conference, which was virtual. It cost $159. She attended on September 29th of 2022. In accordance to the new travel and education policy, it's under the 500, but we are mentioning it at our meeting, make you aware of where we're going and what we're doing. In addition, I received a request just to talk about the bivalent vaccine. And what our department's doing with regard to that. So let me switch gears here. We're talking COVID vaccination. As you know, there's a Moderna and a Pfizer product. The state has encouraged the counties to do one or the other just to kind of minimize the confusion and chaos so that we're giving people the right thing. Our agency is using the Moderna bivalent. Certainly for people interested in Pfizer, they can go to their provider or pharmacies to get that. It's currently available for people 12 years and older. We have a clinic every Tuesday that we're offering. There's a registration link that is usually released the Thursday before. Anybody can have it as long as they finished their primary series or had their booster over 2 months from when they're looking to get their booster. Technically, you don't have to wait after somebody has COVID. However, you obviously don't want to get a vaccination if you're sick. And general recommendations to wait around 3 months, but technically there is not a wait time as long as you're feeling well. We are also offering to homebound. So if anybody's aware of people that are homebound that are looking for that booster, if they let our office know, we usually send out a nurse on Tuesdays because we already have our clinic going and we've got the vaccine open, so we can kind of utilize some of those doses so we're not wasting. And so far we've been monitoring side effects and the vaccine's being accepted pretty well. People aren't getting that sick. And so we strongly would encourage everybody to get vaccinated. They can always call us if they have questions.
Question.
Yeah, my daughter asked me yesterday on the phone if I was going to get the bivalent, shot, and I said, what, help me with that. So it just in terms of what's, I guess, occurred is that we have a disease out there, that a virus that has matured a little bit and has modified itself. And so we have we have new variants of this disease that have occurred over time. And as a result, Moderna has developed a new vaccine, whatever, to address those specific variants that have kind of entered our environment, so to speak. So is that kind of the?
Yes, I can say this bivalent vaccine basically means it covers 2 strains. For people that have gotten flu vaccinations, you might notice that there's trivalent and quadrivalent shots. So that's really where this big bivalent word comes from, is it's handling a couple different strains of COVID. Very well received. I had mine, had not a side effect or anything. I talked to some of my staff that have had the vaccination, same thing, very well received. So I think for anybody on the line, contact your provider if you've got questions, but otherwise go for it. We want 100% vaccinated in Warren County.
So no downside, but an upside.
Upsides.
Potentially. Okay. Thank you.
Thank you.
And-
Oh,
no, go ahead. Sorry.
no, I just knew we hadn't heard from Tom yet.
Of your financials.
Okay, and attachment 4 are the financials as of October 12th when we printed these. Again, you'll see obviously revenues are down because of course our nursing and other, we're just starting to do some clinics, not necessarily big revenues there, but you'll see down below our salaries, big difference, as we say every month from last year to this year because of the COVID grants and COVID dollars we had to spend for salaries to cover everything last year. We're at 43.38% of the budget this year, which is very good for being in October, where last year we were at 74.09%. The next page, attachment 5, is just our comparison from last year to this year at the same time. Again, to bring up about the salaries, equipment. One thing I just wanted to know in the equipment line, which you've seen in the paper, is the HVAC systems that we've gotten for schools. We have paid some of those, and I list here, this is both equipment and also they had to get filters or supplies. But that breaks it out according to this per the schools breakdown for Bolton, Johnsburg, Queensbury, North Warren, and St. Mary's. These are the ones that so far we've already ordered, they've been delivered, we paid for. There are still some that we're working on right now, but at least these are the ones that are reflected in our financials above. Our contractual expenses still, again, with last year and this year in comparison, but our contractuals are down because the numbers are down in our home care. So when it comes to paying the therapist, those numbers are down, but also, again, just due to timing with our preschool program, that can be very expensive, and I just picked up I think it was the September invoices from them last week, so we'll catch up with that before year end, obviously. Revenues, again, are down because of some of the nursing, and then also, like I said, some of the clinics. The clinics are no charge for COVID, and we're starting flu clinics now, as we all know. So we'll start to see some of that revenue come in, and also we've been doing a rabies clinic every month. I believe November is our last month to do a rabies clinic till next, like February or March. So we're getting some donations with that too, and those numbers, I mean, they're not a lot of revenue for the county, but they do tend to be a little bit higher this year, I think, from people catching up because of COVID and we didn't have clinics. So then those animals are getting treated, which is what we want. And that's all I have.
Very good, thank you. Supervisor Conover has a question.
Yeah, as usual, excellent report and
Mhm.
excellent information on the year-to-date comparisons. Before our budget officer started doing his happy dance, 21 compared to 22. I mean, in 21 year-to-date, we are showing about $3 million above revenue, but now so far this year, we're showing 2.6 million above revenues. And I think you explained that down below under contractual, or you can see most of that under your contractual, as you mentioned. Where the difference on the contractual last year to this year is, I don't know, 600,000, 500,000, something like that. And then under contractual expenses, you indicated that we probably have some expenses coming in on the preschool that you say you just received that are not necessarily reflected up above, but you also say contractual, and that's because the contractual is paid on an hourly basis.
Well, no, the contractual is all our expenses on this, the 0.4 as we call them, our rents, our utilities, supplies. But the only thing that does fall under there is our therapists, which are contractual, because so that contractual kind of throws you off, but it is inclusive of everything. So our therapists in our home care, as we know, a year ago, we had nurses due to COVID. I'm surprised, but a lot did leave during COVID. And so our nursing staff is down there, for our revenues are down there, for our therapy visits are down, because we can't take as many patients as we used to. As we get more staff, we can build that back up. But so you see a decrease in salaries, you see a decrease in therapists, and therefore the decrease in revenue.
In terms of your financial plan for this year, budget for this year, you think we're pretty much on target?
No, we had hoped we were gonna get more nurses on board. So of course, salaries are in the budget, revenues are in the budget, expenses related to that, and same with benefits are in the budget. But again, if we don't fill them, then we don't get, so I'm hoping, my goal is always that our bottom line that we budgeted for will be the bottom line, no matter what. You know what I mean? The effect to the county will still be the same.
And we gave up some positions through the budget.
Through the new
Like
budget, we
500,000.
will, with the new budget, we will, but regarding this year's budget. Yeah, I mean, they're in the budget, so are the revenues, but at this point, like I said, they're a wash. And so we're hoping that our bottom line will still be the same. We have had some increases in expenses, as everyone knows, like food has increased, medical supplies have increased. But again, we don't buy as many because we don't have as many patients to see. So on that end of it, you know, we do with what we need to do, and we don't keep a big stock anymore like we used to, because we don't need to.
Well, thank you, Madam Chairman.
Thank you, Tom. That was a very good report.
And as Tom mentioned, we have our rabies clinics, and we have one this Saturday, or I'm sorry, 2 Saturdays from now on November 5th at the Queensberry Community Center from 10 to 12. So just thought I'd mention that for anybody that has animals and would like to get them up to date. And unless anybody has questions.
Any committee member have a question? Not, thank you very much. Appreciate all your hard work, and I know you a lot of work on this budget, so it was good. And with that, I will. Conover, second by Supervisor. All in favor?
Sorry.
Thank you, everybody.
Thank you.